Hello, I'm Elizabeth Cupper. Thanks for joining my presentation on elder abuse. This presentation will walk you through what is elder abuse, the definition, terminology, risk factors, and personality traits that make one more at risk of elder abuse in Australia. It will explore risk factors within a residential health context, which will be described using an ecological framework. We'll present a case study of a complex scenario with elder abuse using a social constructionist perspective. And we'll then use this case study to demonstrate how the discipline of community psychology could go about addressing or problem solving for the issue of elder abuse through evidence-based practice. This presentation proposes that one way community psychologists can contribute to the prevention of elder abuse is through using their skill set to further shift toward hybrid team service models. So what is elder abuse? The World Health Organization defines elder abuse as the single or repeated act or lack of appropriate action occurring within any relationship where there is an expectation of trust which causes harm or distress to an older person. It can be physical, social, financial, psychological, or sexual, and can include mistreatment and neglect, with 65 being the starting point for status as an elder and 70 being the age for access to aged care services. Isaacowicz explored the interaction and overlap between the terms abuse and neglect, finding that there were inconsistencies in its use. For example, where some may classify physical violence, verbal abuse, and neglect under the same umbrella, other studies may view it differently. In spite of this ambiguity, there's a general consensus of the need to focus on abuse as commission and neglect as omission, where abuse as commission being operationalized as hitting, slapping, and burning, restraining, and inappropriate use of medication. Neglect as omission being operationalized as neglect of personal hygiene, malnutrition, and dehydration. For the purposes of this presentation, I will use the term elder abuse, but it's worth keeping in mind that they often present together. The Australian Law Reform Commission identifies disability, cognitive impairment, isolation, and ageism as factors that make them more vulnerable to abuse. It is estimated that approximately 39% of permanent aged care residents are experiencing mild to moderate depression. Big five personality factors associated with severity of depression in elderly people with functional limitations include high neuroticism, low extroversion, and low conscientiousness. Charles describes ecological psychology as, at its heart, a theory of direct perception and how active organisms come to know the world around them. Ecological psychology is limited in the sense that its research doesn't consider mental states in the way that, say, cognitive psychology does. However, for the purposes of this presentation, it's a powerful model to show the dynamics and interactions between an elder, caretaker, and the broader environment around them. This version, adapted from the concepts of Schoenberg et al., proposes that elder abuse occurs in the microsystem context within the caregiver-elder dyad. That is, the interaction between the elder and caregiver. Schoenberg et al. Argue that a significant dependency relationship between the caregiver and the elder is associated with greater risk of abuse. The likelihood of more positive or less negative relationships occurs once the dyad becomes part of multiple microsystems, referred to as the mesosystem. So, for example, if one of the elder family members comes to visit and is either impressed or underimpressed with the care their parent is getting, then this can have an impact on the interactions between the elder and the caregiver at the micro level. The exosystem relates to the relationship between at least two microsystems, one of which does not contain either the old adult or the caregiver, but may have potentially significant impact on the successful functioning of that individual. For example, nursing home caregiver training reducing the likelihood of mistreatment. The macrosystem refers to the interaction between each member of the dyad and broader social values. For example, if a caregiver brings their negative cultural values into their job with elderly people, one can assume it will make the resident more vulnerable to abuse. A case study by Isaacovitz et al. Explored the social construction of elder abuse and neglect in order to capture the notion of context. The rationale for this perspective is that the social interpretation of abuse and neglect revolves around the meanings given to actions rather than around the actual actions themselves. Nancy, who you'll see in the middle, has a complex history of living with her long-term partner, Roy, whose violence, abuse, and neglect has followed her into old age. She is 82 years old, married for 60 years. She has a strained relationship with her 3 grown-up children who have been traumatized by their own neglect and removal during childhood. However, her daughter, Rebecca, who continues to be part of her ongoing care. Whilst in good physical health, Nancy has been diagnosed as suffering from depression due to an ongoing abusive family relationship. However, after failing and breaking her knee, she was moved to a nursing home by welfare services. So how did Nancy go from living with at home to having welfare services move her to residential care? Here is some of the context. Mike, the social worker, was appointed to make an assessment of the situation. However, he'd been working in the community for a long period. He saw this through the lens of intimate partner violence, rather than identifying Nancy as living with elder abuse and neglect. So his previous relationship with Nancy had led to him making some assumptions. Rebecca was torn between 2 viewpoints. This is the daughter. She was socialized by her own family norms of everybody for themselves, but on the other hand, drawn towards the social normative expectations of caring for her elderly parents. Roy's dominant role and history of violence was tolerated until the neglect became visible. Now that his physical and psychological power over her has been taken away, he turned to controlling her by denying her financial support whilst she's now in residential care. He's not actually offering up any support in that respect. The residential caregiver Joe is now bearing the brunt of a lot of the deep-seated issues that were not resolved within the family, and perhaps he may express his frustration in a particular way, in maybe his treatment of Nancy. And Nancy, after suffering through life, experiencing abandonment and exhaustion, has made sense of it all in the construct of being a martyr. Community psychology is in a unique place to use its fundamental principles of prevention and health promotion to further transform how psychologists see themselves, as well as how they fit into a multidisciplinary team. In the example previously, Nancy may have received a much more holistic and practical solution if there was more of a collaborative approach to her care. For example, if a community psychologist was able to coach Mike to take on a constructionist perspective, he may have been able to bracket his own experiences, his past experiences, to see it as elder abuse rather than family violence. Also, if Mike had been part of a hybrid multidisciplinary team, such as the one pictured here, with social worker, community psychologists, occupational therapists, and residential caregiver, he may have had his assumptions challenged and given Nancy the opportunity to make decisions in line with self-determination. The decision to move to a residential care home was forced upon her, with probably some good reason, but it led to the further breakdown of her family unit. Belbin suggests that in order to create teams that are diverse, multidisciplinary, and less susceptible to a clone culture, so heaps of the same sort of people with the same sort of thoughts, there are several tactics you can employ. In this example, we used rich picturing to develop a concept of what a hybrid team might look like in a residential context. Once a concept is designed, a community psychologist can use their skills to sell the ideas to senior leaders. Belbin suggests the following when solving complex issues. Number one, work with your senior leader to identify complex and contentious issues. While it's important to hear your leader's thoughts, Nancy's case would be an apt example. You can then assign the complex case to a hybrid team and ask that they present back their recommendations to top executives. Belbin explains that this step is important because the execs are less likely to knock the proposal back if the work is sound and there are allies in the room to advocate for it. Next step is to use industry best practice and benchmarking. So linking it back to current mental health programs and services, such as the private health network service in residential aged care, and future policy directions such as aged care quality and safety report findings. Then finish off by reaching agreement on the new hybrid team approach to start looking at ways to source internally and externally, and eventually hire candidates. So there's that agreement and then going about recruitment. Once the needs assessment, recruitment and training plan have been established, a community psychologist can move forward into the design and delivery of training with a focus on effective teamwork. In conclusion, elder abuse is a complex and multidimensional issue and requires a multifaceted approach. With increasing prevalence of elderly people moving into aged care, there has been a greater need to address the services available and the standards that we as a community will accept. Community psychologists are well placed to offer their skills to consider social, cultural, political, and environmental contexts when solving for complex issues such as elder abuse. Thank you.